Hi everyone, in this video we will be discussing about axilla and what are its boundaries. Axilla is basically a pyramidal region between the upper thorax and the arm. And what are its boundaries? The interior wall is formed by the pectoralis major, minor, subclavius muscle and clavipectoral fascia. Pectoralis major, minor, subclavius and clavipectoral fascia. It can be easily understood by watching the video of clavipectoral fascia, in which we have already discussed about the clavipectoral fascia. Then the posterior boundary. Posteriorly, there will be scapula. So the scapula will be linked to it by the muscles subscapularis in the above region and teres major and latissimus dorsi below. Then the medial boundary. Medial boundary will be formed by the ribs and the intercostal muscles. So first four ribs and intercostal muscles with upper part of serratus anterior. Ribs, intercostal muscles and serratus anterior form the medial boundary. Lateral boundary is formed by the intertubercular sulcus and the muscles coracobrachialis and short head of biceps brachii. Short head of the biceps brachii, long head of the biceps brachii. Then apex. Apex will be found by the apex. Above we will be having clavicle. Then after the clavicle in the posterior region we will be having upper border of the scapula and medially we will be having first rib. And the base is formed by axillary fascia and skin. Base will be formed by axillary fascia and skin. Then what are the contents? We will having axillary artery, vein and lymphatics. Axillary artery, vein and lymphatics and brachial plexus. Brachial plexus cords and their branches. Then long thoracic nerve. See, long thoracic nerve here is supplying the serratus muscles and the intercostal region. So long thoracic nerve on the medial side and intercostobrachial nerve will be there. It is not shown in the image. Intercostobrachial nerve and the brachial plexus. Brachial plexus, see, the medial one is medial pectoral nerve and then the lateral pectoral nerve from the medial and the lateral cords of the brachial plexus and the upper subscapular nerve. Upper subscapular nerve from the posterior one. And what another thing will be axillary tail of spans. Axillary tail of spans. So that is about the boundaries of the axilla. Let's once again see in brief what are the boundaries. See, on the medial side we'll be having ribs, intercostal muscle, serratus muscle, and long thoracic nerve, intercostobrachial nerve as a content. On the posterior side we will be having scapula, subscapularis muscle, and above anterior major and latissimus dorsi below. On the lateral side, we will be having intertubercular sulcus with the short head of biceps and coracobrachialis. On the interior side, we will have pectoralis major, minor, clavipectoral fascia, and subclavius muscle. And the contents we have already discussed: axillary artery veins, and then cords of the brachial plexus and the branches, and along with that, we have the long thoracic nerve and intercostobrachial nerve and axillary tail of spans. That's all about the axilla. I hope you will like it. Please do like and subscribe my channel. Thank you.